Thank you, Cathaoirleach. The Vision for Change policy published in 2006 was an excellent roadmap for the development of mental health services throughout the country. It set out a whole community response, a community-based service, and it rebalanced the service from what was primarily an inpatient service to a community-based service. It detailed a well-funded, well-resourced and appropriately staffed service, and there was huge and continues to be huge buy-in from service users, staff, carers, families and community and voluntary organisations operating this area. And it is still acknowledged as the template for the service into the future. However, 10 years later, in 2016, the service unfortunately is dysfunctional, under-resourced and understaffed. And we can see that from the situation where only 6.4% of the overall health budget goes on mental health care, compared to almost twice that in some of our European colleague countries. There were still 1,000 fewer staff in mental health services at the end of 2015 as against 2008, and 700 vacant posts currently in the service. Specialist 24-hour mental health crisis services are not evenly available across the country, and therefore people are waiting for hours on end in accident and emergency departments. Around one-third of child and adult and adolescent admissions to hospital were to adult units last year. And there are significantly high rates of suicide in this country. We need now a proper mental health action plan, properly funded, properly resourced, properly staffed, and crucially with an independent monitoring mechanism to ensure that a proper service is available nationwide and evenly spread throughout the country. The Vision for Change policy set out, as I said, a whole community response, and a very good example, indeed an epitome of the community-based approach set out in that document is a unit in my own constituency of Tipperary at Mount Sion in Tipperary town. That is an 8-bedded residential community-based unit which is fully supported by staff and indeed locally by the whole community. It is in fact part and parcel of the local community, where residents go in and out of the unit, have a cup of tea in town, meet the public, and of course there is also huge community buy-in to supporting this unit. And the Friends of Mount Sion have been supporting the unit for nearly 20 years now, not just with ordinary voluntary support and practical support, but indeed significant financial support. Unbelievably, Minister, the HSE has now decided to close that unit. Well, I can tell the Minister, if he was here, and maybe you might tell him, Minister Harris, you might tell him that the people of Tipperary town and Tipperary will not allow that unit to be closed. This is an absolutely excellent unit. And we hear only yesterday that the Minister's policy advisor has indicated that the unit has been closed for fire safety reasons. That is simply untrue. There were 2 meetings recently, one with the Friends of Mount Sion and one with residents and their relatives. The question of fire safety was not mentioned or raised at any of those meetings, nor was it indicated in advance of those meetings. So it is completely and absolutely untrue. And we want the Minister, and I ask you to make sure that the Minister is aware of the situation, and that that this unit continues into the future with the full support, as it has, of the whole community in Tipperary town. Another issue, of course, is the effective robbing of the health budget of €12 million in a situation where we have 700 vacant posts, where community and voluntary organisations are operating on a shoestring. Organisations like Pieta House, Console, the Samaritans, St Vincent de Paul, Grow and Aware, and even locally in Tipperary, the Seesaw Suicide Prevention Service and Taxi Watch. There are other issues as well, Cathaoirleach, including the closure of the acute unit at South Tipperary General Hospital, which has been a complete and absolute disaster and will have to be reversed by the incoming government.